was at a health fair in a hospital last Saturday, and we UT pharmacy students were screening for blood pressure, and we had a patient come in, and she was having just a regular day, no different than any other, and we screened for her blood pressure, and we realized that she was having a hypertensive emergency. So we were able to walk her to the emergency room so that she could receive emergency care. And it was just one of those situations where the patient had no idea, and because we were there, we made a difference.
My very first patient care event was an asthma event with Dr. Self, and we went to an elementary school and told children how to properly use their inhaler. It didn't take us long to figure out that the majority of them did not know how to use their inhaler, and so for me, that experience highlighted the importance of patient care and how we as student pharmacists can impact the community directly.
So one of my favorite experiences from this past year in patient care through ASP has been working with women's and pediatrics. So at one patient care event, we were able to talk to a young lady about self-breast exams. So it was really cool to get to use the model and show her how to properly do it. Watching her leave that day and knowing that she felt more confident in giving herself a breast exam and being able to recognize signs of early cancer was a really good feeling.
Another program that we started this year is a diabetes class at an elementary school, talking to families at that school, which is a lower income elementary school. There are two girls that we talked to the last 2 times that were not told information about diabetes when they were diagnosed. Basically just told you have diabetes and sent on the way. They didn't know what that meant, what kind of lifestyle changes to make, the medications, didn't know anything about that. So we really sat down and talked with them about all the different important aspects about diabetes. And they're just very appreciative and very happy to get more information, better understanding that they did not receive in the first place.
And one of my most meaningful interactions was with a woman who had been newly diagnosed with hypertension, and she was trying to make therapeutic lifestyle changes. And she had this juice beverage in her hand, and we were talking about how to read nutrition labels, and she had noticed that her physician had recommended decreasing, her salt intake, but she hadn't realized that on the nutrition label, sodium meant salt. So just having that opportunity to have a conversation with the patient, this was a woman who was trying to do all the right things, but just had not really connected with making the distinction between salt and sodium. And that was one thing that as a student pharmacist, I could already help with. And then someday as a pharmacist, I will be able to make even more impactful interactions with patients like that. And that was so exciting to me.
I'm the chair for Operation Heart, and every year we do Fred's Blood Pressure Marathon. Basically what that is Fred's donates $1 for every blood pressure screening that we do. So this year we did 600 patients, and really it's so much more than just taking the blood pressure screenings. It's about taking the time out of our day to show them that we care about their own health and maybe giving them the motivation to start caring about their own.
It just kind of goes to show you the need that's out there for these people, even if it's something as small as a blood pressure screening, to kind of make an impact on their day. Because quite a few of them had never gotten their blood pressure checked before, so it was an experience not only for them to get them comfortable with their environment, but also just to show them the importance of health and good diet that we were able to impart upon them.
We're so thankful that patient care has provided us with this opportunity to reach out to a specific patient population.